That's good to know.
And
Now, have you looked at the other forms of omega-3? Essentially, there's two primary ones, which is fish or fish oil, and then krill, which of course has the benefit of being attached to a phospholipid, so the absorption component would be better. And then the one that you're not going to measure in the membranes is the oxidative state. So it has astaxanthin, which is a really potent inhibitor of oxidation. So virtually all of the omega-3 fats that are absorbed are going to be unoxidized, which may not be the case with the fish oil.
yeah, I mean, I'm aware that obviously krill oil is certainly a new player on the scene and has a lot of promise. We're just needing more data.
So you haven't looked at it specifically.
I haven't studied it. We've done some analysis for some of the krill oil companies as they're developing, doing the preclinical, the animal research. We're measuring the omega-3 levels in rats, for example, that are given krill oil versus fish oil, and we've done some human work with them as well. But these are not published studies yet.
Anything that you found or can comment on?
What I can say is what is published from, I think, reliable sources is that on a gram for gram omega-3 basis, if you want to look at the absorption of the increase in the omega-3 index per milligram of omega-3 fed.
Perfect. Yeah, that's exactly the question.
That's the way you look at it. You actually get more omega-3 from eating krill.
Yeah.
I mean, it goes up. I think part of the challenge is that the product itself per pill. There's just not as much omega-3, so
right.
it may be kind of a wash at the end of the day. But we have a lot to learn about krill and the whole phospholipid delivery system. And it may very well be a benefit to that we're not yet aware of.
Well, are there any other comments you'd like to make about this?
Oh, gee, the good interviewer always says that, right? Is there anything I've forgotten to ask you? I think one thing we could talk, if you don't mind getting off the omega-3 a little bit, but straight into the red blood cell fatty acid, because the other advantage of getting a red blood cell fatty acid test is we can also measure the trans fatty acids in the blood. And of course, trans fats are the ones that are produced from industrial treatment of vegetable oils to make margarines and shortenings, and they're pervasive in baked goods and fried goods. The trans fats are the bad fats, and just about everybody agrees with that. And so we can measure that level in the red cell as well. And although there's not nearly as much data that will allow us to say, like we have for the omega-3 index, and 8% is good, 4% is bad. We're not quite there with trans yet, but we are developing those metrics. We can say if a doctor has a patient or an individual wants to know themselves, they do a omega-3 a trans test on the red cell. It's in the same profile as we do the omega-3 test. And they get their trans level, and then they change their diet. Doctor says, look, you got to go on a better, healthier diet. You got to get rid of all these. You got to get rid of all the donuts and the pastries and the pizzas and French fries, etc. All of which contain trans fats. And if then the patient or the individual follows that advice and actually does reduce their intake, we'll see it. We'll see it in the red cell trans level. It'll drop. So it's a good indicator of following a healthier overall diet. That's good. Helpful. But, otherwise you just, I go to my doctor and say, Doc, I've changed my diet. I'm really eating better. And the doctor says, well, let's find out.
Yeah, absolutely. So this trans omega-3 is part of the normal omega-3 index that is performed? Or is it a separate assay?
Right. No, it's the same assay, but it's and I misspoke. It's not actually trans omega-3. It's just trans fats.
Yeah, that's what I would think. Because because you talk about these processed foods, it's mostly omega-6s that are in omega-3s. So
or omega-9s omega-9s or omega-6s are the ones that are the trans.
Okay.
Can have that trans configuration. It's just the way a double bond in a molecule is flipped.
Sure.
And so, it's not an omega-3 question. It's a completely independent question. And we've actually looked in the Framingham study and seen that if we measure the trans fat levels in the late 1990s, and then we measure it again in the mid-2000, around 2006, about 7 years later, we found that, and that was during a time when American food industry was trying to remove trans fats from the diet as much as they could. And we found a 23% drop in the trans levels in Framingham, and none of those people are trying to eat any better. It's just the background diet, the background level of trans in the American diet is going down. It's not nearly as low as it should be, but it is going down, and we were able to track that with red blood cell trans fat levels.
Excellent. So again, I'm sorry, you mentioned I still don't understand. Is this assay performed as part of the regular omega-3 index, or is?
Yes. Yeah.
Okay. So you get that, and you've actually been doing that since the beginning.
Yes.
Wow.
Right. It's just another piece of information that comes out of the fatty acid profile.
Yeah, you're right, and that may in fact be even more beneficial. Have you analyzed the data to see what may be an optimal range and any correlations with people with heart disease or the other?
Not as much as we'd like to. We'll be able to do that as we move further into the Framingham study and the women's health study. We'll be able to say, oh, it looks like this level of trans is really bad. We'll be able to see that in these studies as we go forward.
And now we've been referring to this assay that you developed, and really you're the pioneer in this. It's not a typical assay that one can obtain though from their primary physician. I mean, it's possible, but how commonly available is this? And if someone is interested in getting this test, what would they do?
The best way, I think, at this point to get at the test, and there's the whole world of direct-to-consumer testing, and then there's through your physician as part of a health workup.
Sure, sounds great. All right, any other comments?
I think that's it.
All right, well, great. Well, thank you so much.
Very nice talking to you.